Hello and welcome. You're watching News of the Hour on youtube.com/NDTV. I'm Ankita Mukherjee, and today we're going to concentrate once again on the coronavirus outbreak. Coronavirus, which has also been termed COVID-19 by the World Health Organization. That's the name by which the viral outbreak is now being talked about. Well, today, Prime Minister Modi himself tweeted about COVID-19 and said that there was absolutely no need to panic as a renewed coronavirus scare gripped India after two new cases, confirmed cases, became public over the last 48 hours. The Prime Minister, in fact, went on Twitter to say that he had held an extensive review with ministries and state governments regarding India's preparedness levels, and he said that the government was working in all possible ways to contain any further outbreak of the virus. He asked everybody to work together and also take small but important measures to ensure self-protection. So what did the Prime Minister talk about? He talked about basic protection methods, frequent washing, especially of hands, and covering the mouth with a tissue when sneezing or coughing. Wearing masks in crowded places is also being talked about as a basic precaution. Well, here in the national capital, Chief Minister Arvind Kejriwal held urgent meetings with Health Minister Satyendra Jain, and he also took other officials spoke to them to take stock of Delhi's preparedness. Remember, this is the first time a positive case has been found in Delhi. Now, what about the case itself? Well, this is somebody who obviously traveled from abroad. The first case in Delhi was confirmed after the parent of a child in a private school in Delhi's neighboring city of Noida tested positive for the virus, and there is a bit of a panic in the school as well. The school is now going to be shut for 3 days, we're told, the 4th, the 5th and the 6th, from Wednesday to Friday, that is. This man, in fact, has a travel history that included Italy, and Italy now is one of the main countries in Europe which has seen a sharp spike in both the numbers of positive coronavirus cases as well as the number of deaths anywhere in Europe. Now, according to sources, this man who traveled back from Italy, or rather had a travel history in Italy in the last fortnight, was not actually screened at Delhi airport. Now, why is that? Anyone coming from Italy is being automatically screened right now, as it's seen as a hub for the virus. But it was because this man was actually entering India from Austria. He was on an Air India flight from Vienna, and he didn't self-declare that he had been in Italy in the last fortnight, and so he didn't have to undergo mandatory screening. It was only after he went back and developed a fever and then let authorities know that he was tested for coronavirus and indeed found to be positive. But lots of things happened before that. Now, what we do know is that his family members had come in close contact with him, including some of them who live in Agra, and they are now also being tested for the virus. The health ministry, in fact, acknowledging that there are at least 6 cases with quote-unquote a high viral load that were detected during sample testing in Agra, and that these people have now been kept in isolation. These 6 had come in contact with the 45-year-old man who has been declared corona positive in Delhi. Now, this man is a resident of Mayur Vihar. He had visited them in Agra, and that would account for these cases. Now, an Italian tourist in Jaipur is also suspected to have been infected after he tested positive in the second examination. His samples have now been sent to the National Institute of Virology in Pune for a final confirmation, and that's awaited still. The first test result had tested negative. Now, the second positive case that has been reported in the last 24 hours or so is somebody who is currently in Hyderabad, but he's a young man, a techie from Bengaluru, who had in fact traveled back from Dubai. In fact, he spent a day and a night in Bengaluru before he took a bus from Bengaluru to Hyderabad. Now, at this point, Karnataka obviously is also gone into overdrive to try and contain the people who have been in contact with this man. So there is his roommate, there are all the people he traveled on the bus from Bengaluru to Hyderabad. So all of these people are now being tested and being asked to stay in isolation. Now, the government, as you know, had already launched a massive operation to bring Indians back from Wuhan, which was the epicenter of the global outbreak. As many as 119 Indians stranded on a quarantined ship off the coast of Japan were also brought back. But overall now, globally, the number of deaths from the coronavirus outbreak has crossed 3,000. And overall, across the world, the number of cases, the number of total cases has now crossed 90,000. So the real worry is the disease spreading across countries, and India has now issued an advisory that it has suspended visas on arrival to Japan and to South Korea. This is for nationals from these countries who have not as yet entered India. Those who need to travel to India or have compelling reasons why they need to come to India may now seek fresh visas from the Indian embassy or consulate. The government has also now issued a new travel advisory for Indians who want to travel abroad. Now, it has asked Indians to refrain from travel to China, of course, which is still being seen as the global epicenter of the outbreak, but also Iran, which has seen a sharp spike in cases, South Korea, and Italy, which has seen the maximum number of cases in Europe. In fact, it has also asked citizens to avoid any travel that is non-essential to other COVID-19 affected countries. So any international travel right now to a country that has reported cases of COVID-19 is now not advised. So this is what we have for you right now. We're going to keep tracking this very important story that is crucial for so many of us and continue to get you the latest news updates on this, as well as get you much more about how you can be aware and alert about COVID-19.